I find that the job that they do is so important and is so much appreciated, and given the opportunity to give back, I find that very important.
We're dealing with past trauma, we're dealing with moral injury.
They are our nation's heroes and they deserve it. They deserve a place where they can come and know that the staff cares. My name is Amy Canada. I'm the admissions director at Oxford Treatment Center. My primary responsibility is admitting patients and making sure that they have a good experience from the very beginning of their treatment all the way through. The veteran population has needs that the regular population does not have. They also have experiences that other people have not had. And it's really important for us to be able to offer a place that not only understands the unique needs of veterans, but is fully equipped to be able to help them recover and find the solutions that they're looking for. Veterans administration offices that we typically work with are very good with coordinating transfers of veteran care from the VA to us. So we usually have a VA representative who will send us all of the necessary medical documentation, authorizations that they need to be able to show that the VA is supporting their efforts in admitting to treatment. And we review all that. Really, for veterans, the only thing we screen for is acute medical or acute psychiatric issues that might make that veteran not safe enough to be on this campus right now. They may require some additional medical stabilization before they're safe enough to be here. But ultimately, as long as that veteran is stable and wants to be in treatment, we're here for them. So the intake process for a veteran would simply be just reaching out for the admission. Our staff can then communicate with the VA, ensure that we have all the necessary documentation so we can move forward, make sure that everything is taken care of. We really do a lot of the work for the veteran. We don't really ask them to do too much other than be willing and give us the information that we need, so our staff will make sure that everything gets taken care of. When a veteran arrives on campus, they'll be seen by a nurse. We have an admission nurse, an RN, who will admit the veteran. The admission process will start with a COVID screen. So immediately upon arrival to campus, you'll get a COVID swab. And once the COVID swab results come back negative, the nurse will begin with the assessment process for intake. And that includes a comprehensive medical nursing assessment, as well as a skin check, a luggage check, and some other documentation that needs to be signed, paperwork that needs to be signed. And then at that point, they'll reach out to the provider on call to discuss detox protocols or what's needed to get that patient comfortable immediately and get them into a detox bed. You're gonna find it's gonna be difficult to find veterans who are not dual diagnosis if they have substance use disorders. I think the very nature of combat and the other experiences that veterans have in active duty is traumatic for them. So a lot of times veterans have PTSD, usually are admitted to us with the co-occurring diagnosis of depression or anxiety. So it's very common that we admit dual diagnosis veterans. We provide drug screens randomly, and we also have the opportunity to drug screen patients if we feel that there's a concern or a need to. With our veteran population specifically, they frequently travel on and off campus to go to appointments at the VA, medical follow-ups, things like that. So we always give them a drug screen when they come back onto campus after having been away at an outside appointment as well. I think the biggest thing that we do different for veterans is make sure that all of their housing and programming is contained in one area. They really get the opportunity to be separated from the regular population on campus. So that means they have the opportunity to eat their meals together. They participate in their own process groups. So really, I think the biggest difference for our veteran population is the opportunity that they have really to truly program in a separate track with only veterans, with a therapist who works only with veterans, and a case manager who works only with veterans. My favorite part of working with the veteran population is how grateful they always are to be here. Our veterans are some of the most well-engaged patients that we have in our program. They are true leaders in the community here on campus, And it's beautiful to be able to see them reach out to one another and other patients to really show support and leadership.